congratulations, Torrance Memorial Medical Center. This is a big deal, and I'll share with you what their story is. Their transformation was with IDSI. So for those that don't know, IDSI is the International Dysphagia Diet Standardization Initiative, I believe is what it is. I should have had that in front of me reading that.
Sounds right.
It
sounds right.
But it is something that is very near and dear to me because I am a clinical dietitian. I was a clinical dietitian. I haven't worked clinically in years. But as a dietitian, this is very important. We're talking about, essentially, this is standardizing language and definitions of dysphagia diets, and for that consistency between hospitals around the world, all of that for patient safety for those people with dysphagia. So Torrance Memorial was implementing this framework in their facility, and it's a process. I know some of you have gone through this before, and it's a process. It's a lot of stuff. It's a lot of testing recipes, reworking your menus, revamping recipes, redefining and renaming all kinds of things. And so it's a big deal. And what they did is, with the support of their arm rep, Allie, who was
shout out to Allie.
I know she's still in the chat.
Yeah.
And another customer, Christy Daly, who presented on our 2022 virtual user conference, who did an IDSI presentation. She connected with Danny at Torrance Memorial on this topic. Danny had reached out through Allie to get contact information and connect and get some great guide on how to do this from Christy. She really got some great input. So they created at Torrance Memorial this well-organized, comprehensive timeline for their rollout. Yes. They have their interdisciplinary team for best practice, for the smooth implementations, dietitians, speech therapists, food service managers, cooks,
IT,
nursing. Yes, IT. I mean, IT is in everything, right?
Yes. But just think about all the different departments, right, that they had to bring together.
Yeah.
Wow.
Your EMR. It is widespread. It is a whole hospital situation.
Yes.
And prior to implementation of IDSI, there was a lot of confusion over dysphagia diets, which is true, and which is the whole purpose of IDSI. That's why it has been rolled out across the world, to really address that pain point. Yes. So this implementation of IDSI allowed for more structured definition of dysphagia diets for them. They were actually within Hospitality Suite, they were able now to revamp their menus and include real clear instructions within each recipe for what to do, how to prepare each different dysphagia recipe, so that it was meeting the standards of that dysphagia level for the diet to really help improve and reduce risk for those patients. So that's really important. They use the recipes and the clear instructions that they were able to put in it. They used as a training tool for their cooks, new and current cooks were able to use that and have consistency across their team.
I love that, because it's so much about like implementation, but also maintenance, right? And making sure that you can incorporate this into your workflow. Yeah.
That happens in hospitals. Yes, it does.
Yes, it does.
So, and here's my favorite part though.
Yes.
I mean, all of it's been my favorite part, but this one really it touches my heart. Not only do we know that she connected with another customer of ours after she had heard her talk on a VUC about some guidance to go through this process and tips and things like that. But now Danny at Torrance Memorial is helping other hospitals also go through this process. So she is paying it forward, which I love to hear. She's got this whole process down. They have been live with it, I think, it's been a while now, maybe over a year. But it's been a process for them. They have a lot of experience with it, and they're paying it forward, which I love to see.